Good evening, mamas. What a day it has been, Bloom 2020. It's certainly not what we anticipated it would be this year. If you were with us last year at our live in-person event at Mercy Hospital, you know what a special event this is. But we've made the best of it, and here we are. We're coming to the close of our day with really, I think, one of the most exciting elements of the entire day, and it's our expert panels, because we all have questions and we all want answers. And so we have some wonderful experts tonight from Mercy Hospital. We're so thankful to partner with Mercy and grateful for just their support of this event. And tonight you're going to hear from three experts on three different topics. And so let's just dive right in. At any point, if you guys have questions, drop those in the comment box. We will do our very best to get to them. You ladies have been wonderful all day submitting questions. So we've got those and we're going to do our best to get through all of them, but feel free to engage in the comments, and we're going to keep this just right under an hour. And then our next expert panel will be immediately following at 9 p.m. So let's dive right in. I'm so excited to first introduce you to Dr. Maria Plata. She is a neonatologist, a leading neonatologist at Mercy Hospital. She's certified by the American Board of Pediatrics and the American Board of Neonatology and Perinatal Medicine. So she's been awarded honor roll status by Health Grades, and she's also practiced pediatrics. So she has got a wealth of information to share with us. She moved to Miami in 2014. So she's been here in South Florida a little while and knows the vibe here. And if any of you, I know some of you listening have had firsthand experience with the NICU at Mercy Hospital, and everyone sings praises of the Mercy NICU. And so that is huge. And we're so excited to learn more tonight. So Dr. Plata, thank you so much for being with us.
Thank you for inviting me.
Oh, we can't wait. Well, let's dive right into the questions. We had some moms submit questions specifically for you. Before we do, can you talk about just the question we all have with the COVID environment right now? What measures are being taken to ensure health and safety of not only moms, but newborns at Mercy Hospital?
Yeah, so since the pandemic started, Mercy was very swift in making some changes to keep our patients, our family members, and our personnel safe. So everybody that enters the hospital as a patient gets tested for COVID upon admission. So we can identify a patient that is infected versus one that is not, and isolate them properly if needed. Everybody in the hospital, whether it's a healthcare provider or a visitor or a parent, needs to wear a mask at all times. So we're practicing social distancing within the buildings, of course. And we are also, well, making sure that we, like I said, cohort patients accordingly. So once we identify a patient that is sick or that is infected with the virus, then we isolate them properly and we maintain, so we contain, let's say, the infection within the hospital.
Right.
So right now that it's been a few months of this, we are pretty comfortable with this. We all wear a mask all the time. And that has really helped with maintaining our patients safe.
Good. And I know a lot of moms have this question, but if perhaps, you know, say I'm 33 weeks pregnant, and say I heaven forbid come down with COVID, but then I go have a baby, is my baby separated from me, or am I still able to spend time with my baby? Or
yeah, so the indication, the recommendation depends on the clinical condition of the mom. So if you're sick and you cannot take care of your child,
right,
then the baby goes to an isolation room and is taken care of by a nurse.
Right.
And the baby would be separated from the mom because this is a person that is sick, that cannot properly take care of the baby.
Right.
But there are a lot of asymptomatic moms that are positive for this virus, and those we try to keep them together. Our goal, obviously, now that we have more knowledge about this, our goal is truly to just educate these moms on how they're going to properly take care of their babies safely at home.
Right.
That to always wear a mask, you know, obviously the obsessive hand washing that we have with any newborn. This is to stress the care that you have to take with your baby. But the most important thing is the wearing a mask while you still have the virus and you're in a contagious phase of
Right.
the illness.
Right.
So
Okay.
the separation really depends on a few factors, and mainly is the mom capable of taking care of the baby or not? That's
Right.
really the key,
Okay.
right? But if you're not sick, no, our goal is to keep you together and train you so you can properly take care of your baby at home in a
That's
safe
great.
way.
That's
Yeah.
great. Side note, one of I think the best features of Mercy Hospital, aside from all the amazing staff, because let's be serious, but the bay views for these mamas. Where else can you deliver a baby in Miami and just have a vacation?
Yeah. Well, we wish it was a vacation, but it is really
Yeah,
just a
that's
very
right.
relaxing view that helps
That's
with
right.
the transition into motherhood.
That's right. That's right. I love it. Well, tell me. So, one mom asked that she had gestational diabetes when she was pregnant with her son. Should she be worried that he could get juvenile diabetes? Is there a correlation there?
No, these are two completely different entities in the sense that the diabetic, in this case, is the mom and not the baby.
Mm-hmm.
So the baby's metabolism will adjust to being born and not have anything to do with mommy's diabetes, let's say.
Right.
The only concern would be if there's a family history of juvenile diabetes, then your baby is at risk, but it has nothing to do with the maternal diabetic state during the pregnancy.
That's very separate. Yes, that's good to know. Great. Talk to us just about describe the NICU at Mercy and just the services that are there, and then speak a little bit to, if a mom has to have a NICU experience, it can be very scary. I can't imagine. I've never had this experience myself, but having friends that have, they say you just can't prepare for it. You just, and every experience is different, but maybe give some advice to moms who just maybe nervous about delivering or just the whole experience. Assure us about the NICU at Mercy.
So our NICU is a small unit. It's a small unit. It's a level 2, so our degree of intensity, let's say, is a level 2, which
Okay.
means we can take care of some very sick babies at times.
Mm-hmm.
And you really want to give birth at a hospital that can provide care for your baby if your baby is more sick. That, like, to me,
Right.
it's like the number one decision I made when I was pregnant, right? Is the
Right.
hospital where I'm giving birth capable of providing care for my baby if my baby is more sick, because it is unpredictable what's going to happen even to a perfectly healthy normal pregnancy at the time of delivery.
That's right.
So our unit is small. It's very family oriented. We try to do family oriented care, which means our parents participate in rounds of the medical decisions that we make with their babies, obviously with the limited understanding that they can have. That's why we're there, to explain everything that we're doing. But we really want to get them involved into the care of their child. There is no way to prepare for this. Absolutely, there's no way, because it really depends on what the baby is doing, how severe this can be, and it is extremely stressful no matter the severity of the child. But take it one day at a time. Listen to what the doctors and the nurses are explaining. Ask questions. If you have any questions, just ask, because the worst thing you can do is live in doubt, and then you create your own answers and you cannot really move forward if you really don't know what's going on. So always ask questions. And we try then to be, like I said, a very inclusive unit, which it has changed since the pandemic started, because now the visit is very limited only to the mom or the dad. Before, we used to have grandparents, uncles, like family members sometimes could come, and that would provide a lot of support to the parent. Now it is only the parents. So it does limit a little bit that interaction that we have with the families that we normally promote. Hopefully at some point we'll go back to that. But our nurses are very well trained, and we answer the phone 24/7. So if there's a question, you can always call. The babies are obviously all the time with a nurse that is taking care of them. And we as neonatologists are in the hospital physically present 24 hours a day, 7 days of the week. So the babies, really, if there's a problem, where they're ready to take care of them. So, try not to worry as much as you can. And if you're worried, just ask and voice your concerns. Sometimes what you need is just to listen and hear the same thing several times until you understand really what is going on. And then we can help you deal with the anxiety that you're going through, as we get to know you better, because sometimes these babies are in the hospital for a few weeks. So we get very close to our parents and their families, because they, obviously we see them every day, and we see these babies heal and grow and get better. So it is a very close relationship. So, I don't know if that's helpful, but
Yes, that's so helpful.
there's no way
And
to decrease the anxiety really when you're going into it,
Yeah, and it's just hard, you just don't know what you don't know until you're there. But I think the encouraging thing, I love what you said. I'm on baby number 3, but I've never really given the thought to, I kind of think, oh, I want to go to this hospital because I like that OB or whatnot, which is certainly a good thing. But no one ever anticipates that their baby, heaven forbid, would have an issue or, a sickness after they're born. But that's so smart to be considered and say, I want to deliver at a hospital where I know they can serve my child and my family immediately after that deliver. So that's a great piece of advice. Thank you so much, Dr. Plata. One more question. Yes. I was speaking with some moms today who were moms of babies in the NICU, and they were just raving, saying those people are angels. They're literally angels on earth. So it's just amazing. And thank you for all that you do. But one mom did say, I said, what's something that you wish you had known, And she was talking about how you bathe a baby in the NICU, because it's very unique and challenging. So is that something you could speak to quickly?
Yeah, so it depends on the age of the baby, and it depends on the illness, right? If the baby is very sick, we don't bathe babies on a daily basis, especially if they're very, very sick. But usually once babies start healing and we can proceed to a bath, really what we do is sponge baths. Essentially, they are bathed in their little bed that is attached to a machine that keeps them warm. Right. And you clean them with a moist washcloth, and that's how we bathe them. Yeah. I worked in a unit in New York where the nurses would bring like a little bathtub to the bedside, and then they grab the little tiny preemie, they put them in the water, they give them a quick bath, they could connect them back. It's fun. Amazing. It's a lot of fun. But essentially a sponge bath is the most common way to bathe a baby in the NICU, and we only bathe them when they're very stable and they are already healthy and trying to get ready to go home. And that's when we also teach the parents how to bathe the babies, because that causes a lot of anxiety.
That's right. I know. Oh, I can't imagine. I was nervous bathing, my 8-pounder the first time. So I can't imagine a sweet little tiny preemie baby. But
the truth is that it depends on the age and the size of the baby and how sick they are, if we can bathe them or not. Right. Right. But it's usually a sponge bath.
That's great. Awesome. Well, good advice. Forgive me if you see me glancing, it's because I'm keeping up with the comments. All the ladies are making some great comments. So wonderful. So one mom asked, how long does the testing process take, COVID, if they're going in for an induction to give birth? Like, is it a quick turnaround?
That may be a better question for Dr. Cardenas, but I think that now we have the rapid test that comes back fairly quickly. Okay. I think the PCR, which is the one that we use to confirm a case when you're like highly suspicious, that takes maybe almost a day or so. But the rapid test is very quick, no? Dr. Cardenas is the one that knows this.
Yeah. Okay. Tell us, doctor. Tell us.
Yeah. So hi, good evening. So yeah. So we, the turnaround's gotten definitely faster as time goes by versus before we used to have to send the labs out and then across town and so forth. And right now we're getting an answer usually within a couple of hours. To at most about 12 hours to get an answer on the COVID test, which is helpful, because the handful of cases that I had personally with my group, my colleagues that were positive, most of them we found out at the beginning was after they already delivered, and then we would find out, hey, she was positive, and then we're kind of just adjusting a little bit of like the contact precautions that they had between the baby and so forth. Obviously, with the guidance of the neonatologist, so we would kind of coordinate that. But now they're being pretty quick. They're pretty quick about it. And I think most hospitals across the United States have much faster capabilities, the same as we do. So usually within a couple of hours, you have your confirmatory test.
That's great. That's great news. Yeah, I wasn't sure how that worked. So that was a good question that we got. Good question, mamas. Keep them coming. Well, wonderful. Dr. Plata, thank you. I think we're going to transition now to Dr. Ernesto Cardenas. So he is from Colombia, And I am not. I am gringa as all get out. You all know this. All the moms watching know. So I told him, I said, I'm going to butcher your name, and I just apologize to begin with. But we're so thankful that you're here. I enjoy following you on Instagram. You do great content about OB on Instagram. So follow there. But we're excited to have you with us tonight. And we have plenty of questions for you. We're going to dive right in. But I love, you've got lots of accolades. You were in the Army, correct? Was that right? In the Army?
I was in the Army. I was a battalion surgeon, and amongst other things.
Amazing.
I've had an interesting life.
Yes. And you've got to tell us, the most interesting thing are those two children, right? This is the most interesting thing about you, right?
My two kids definitely make life interesting. Yes.
I love it. I love it.
That's a valid statement.
We all can relate to that. Wonderful. Okay. So I know the mamas have a lot of questions about OB. Let's jump right in. One of them specifically, it's a very specific question, but it's been 7 years since her last labor. She's due in December with number 3. Understanding that, of course, every pregnancy is different and not having any current problems, should she anticipate a higher risk of issues come this delivery, since it's been a little while?
So yeah, so I get a lot of moms who are, nowadays, so just, a little side bit, women are having babies older in life, like later.
Yeah,
sometimes they,
right.
I call it, they get their second wind, right? I had my kids when I was young. I had career stuff going on. I delayed, childbirth to later on, and so you have these disparity. You have a 20-year-old at home, or not at home at college, and then and then all of a sudden you're pregnant. My mom had me at the age of 42, and I have a nephew that's actually a couple months older than me. So my mom and my sister were pregnant at the same time. And the one thing I can tell you that I've learned over doing this over the years is that the body never forgets. It's kind of like it's almost like riding a bike.
Like riding a bike, right?
Like riding a bike. I tell my patients all the time. I tell them all the time, it's like riding a bike. And so don't doubt yourself and don't doubt your body, because when it's time, that first delivery, hands down, is always going to be the toughest delivery, because you are learning something, you're doing something for the first time ever. And then after that, it's almost like autopilot. Second, third, fourth baby, I don't care how many years apart, you would be surprised what the human body is capable of doing. So I can guarantee whoever is concerned about that 7-year gap, that third baby is going to be a lot easier than that first baby.
That's good.
I've never seen it be otherwise. Yeah.
How many children do I have to have before they start walking out? And it just,
well, I had one almost walk out the other day. It was her 5th baby, but yeah, it was got just at the nick of time.
Amazing. Okay, let's talk a little bit, a few questions about C-section. So what are your thoughts on multiple C-sections and the complications that could occur?
So, C-sections are like any other surgery. So anytime that we go into somebody's tummy, we're changing things the way that were originally, right? So, there's something like that. We always, as surgeons, we say something called like, oh, I'm doing a surgery, and we call it like a virgin belly, right? Like I'm going into a belly that's never had an incision, has never been manipulated. And those are typically going to be, technically, from a technical standpoint, for us as a surgeon, easier than a second and a third and fourth. But one thing that's remarkable that you'll see is that everybody heals different. So it used to be, I remember like years and years and years ago, moms used to get scared by their doctors, and they would tell them, you can't have any more than 3 C-sections or more than 4. Putting a number on how many C-sections you have is a mistake, because everybody heals different. I've done C-sections that it's the second C-section, and I say, man, this is a tough one. And you just have to work a little harder, be more diligent and so forth, because the anatomy is distorted. And I've had moms that have done their 4th or 5th C-section, and it might as well have been her first. Every single person heals different. Obviously, there's going to be risk factors. If somebody had like a really bad infection, if somebody had a history of other surgeries, like when they take their appendix out, called an appendectomy or gallbladder removal, things like that can cause inflammation, will make it technically more difficult. But I wouldn't get so hung up on the number of C-sections that you've had, as long as you have a competent surgeon who is invested in your health and is well trained and willing to deal with, whatever, we'll say inconveniences that can come up in the surgery. We'll do fine. We do fine. We've all had tough surgeries. We've all had easy surgeries, but I think we can all say that in the end, all babies come out and all moms do okay. And that's been my philosophy. So I wouldn't get so hung up on the number of C-sections that you have.
Okay, that's encouraging for those mamas. Awesome. Talk to us. This is just kind of popped in my head just right now. I think it's fascinating. But do you know how many babies you've delivered? Más o menos.
So the last time I actually physically counted that I actually had to was when I took my boards. So
Right.
as doctors, after we do all our training and we think we're done, in our case, the American College of Obstetrics and Gynecology says no, you're not. So you have to now prove to us that after all this learning that you've done, that you actually know what
You
you're
can
doing
do
in a
it.
clinical setting.
That's
So you
right.
have to give them case logs of how many babies you delivered. So
Wow.
at that point, which was, I don't even want to tell you how many years ago when I was taking my boards, I was like around like 3,000 or so, if not more. Since then, add a couple more thousand. I don't know. So
Wow.
it's up
Amazing.
there.
Amazing. So I have to say, I know all three of you that are with us tonight. I can't imagine the challenging parts of your job. Like, I just can't imagine. But I have to also think that it must be such an incredible joy to see just the miracle of life and see it happening right there firsthand. It's just incredible. So I love the thought of you all being involved in that. I know that's meaningful for you.
It is awesome. It's a bizarre concept to see a person make a person,
Wow.
right?
Yeah.
And so many patients that I have that are, I've known them from just their regular annual checkups, and then you see them along the years that now they're married, now I'm having a baby, we're planning. Then before I know it, I'm delivering their second and third baby, and you're like, wow, I was part of that journey, and it's pretty cool. It's pretty to see that evolution
Neat.
as people grow their families. It's really neat.
That's awesome. That's awesome. We have another question about C-section. So one mom says that she's having her second C-section in November and she's getting her tubes tied. So would she have to be in the hospital longer since she's having her tubes tied as well? Or is that kind of like do it all
So,
together?
absolutely not. It really will not change your hospital stay. The techniques that we use for when we do a tubal ligation are very simple. I would dare to say that, sometimes you hear things like, I had more pain because I heard that you get more pain after a tubal ligation C-section versus just a regular C-section. And if I were to tie somebody's tubes, which obviously I wouldn't without telling them, right?
Right.
Or tell them that I did and I didn't, the patient would not know the difference.
Never.
They're gonna have the experience the same amount of surgical pain one way or another,
Right.
either a little or a lot that we're going to,
Right.
regardless of whether we tie their tubes or not. So it doesn't delay at any way whatsoever their hospital stay or their recovery.
Great. All right, ladies, if you're just joining in with us, we're so excited to have our panel from Mercy Hospital. If you have any questions, drop those in the comments. We will we'll do our best to get to them. Some moms are asking about VBACs. They just said VBACs. Tell us about it. So what are your thoughts or tips or?
Well, thank you for giving me easy questions like VBAC. So VBAC is like a very politically charged thing, right? Because the idea of VBAC is vaginal birth after cesarean delivery,
right?
And if you talk to the experts, and there's been a big push in the United States to decrease the C-section rate, because we had for a period of time, and probably it's starting to taper down a little bit if you actually go by the numbers. Our C-section rates were very high. Still not as high as other countries. I take care of a lot of patients from Latin America, and their C-section rates are really, really high. Depending by the city. You go to Caracas, Venezuela, and you're 95% C-section rate, which is kind of insane. So there's been a push to reduce the C-section rate, and one of the ways that has been advocated by the American College of Obstetrics and Gynecology is VBAC. It's a women who've had a C-section in the past, see if they can at least try to have a vaginal delivery. So the real risk when we talk about a VBAC is what is the risk that scar on my uterus can open up. That's called a uterine dehiscence. Because if you think about the uterus is a big ball of muscle, and it contracts in order to force a baby out of that big ball of muscle. And when those muscles are contracting, they can actually generate an intense, ridiculously stronger than any bodybuilder you can possibly imagine when it comes to those contractions. So the risk is that in doing so, that you can potentially cause harm and cause that old scar to open, because no matter what, whenever you cut something and it heals, it'll never be as strong as it was initially. And that's the risk of VBAC. And the risk of that happening can be anywhere between 1 to 10%, depending on exactly where the incision was made.
Wow.
So if you're one of the moms that had a C-section, that's what we call lower uterine segment, which is the most common type. then your chances about 1% of that uterine dehiscence happening, or you can look at it as 99% chance of it not happening.
Yeah.
So it's kind of, you have to see, well, do I want to assume this risk? But that risk can then climb up as high as 10% if the incision was up through the muscular part of the uterus. So sometimes, one of the challenges is identifying what kind of C-section I really had, what were the circumstances, and then before assuming that risk, there's other elements have to be in place. You have to have a doctor that's willing to participate in the VBAC, because there is a lot of risk all around shared between the patient, the doctors, over assuming that big responsibility. You have to be in a center that has immediate surgical capabilities. So you can't be at a place where they have to call in an assistant or so forth. And you got to have also anesthesia on board 24/7. So there's a lot of things. Most hospitals will meet these criteria, but it's a very individualized thing to do. Because there's this risk involved with it. When it works, it's awesome. When it doesn't work, it's not so awesome. And that's what people need to take. They need to have that conversation with a doctor and say, hey, do you think that this is the right idea for us, the right move, and then come to that decision.
That conclusion together. Wow, good. You handled that one really well. That was good. Lots of great info. Awesome. Okay, another question from a mom is, family members are continuously recommending that she wear an abdominal binder postpartum when she had her son naturally. She's like, I have a feeling that it's an old wives' tale to do that, but then I think, well, maybe I should. Like, any thoughts on that? Does anyone have any thoughts on that?
So one of the first things I get asked after I deliver a baby is, when can I put on my faja? Faja is in Spanish is the binder, right? Because that is the security blanket of a lot of women.
Goodness.
I have my binder.
I'm like, give me all the stretchy pants.
Yeah, and it's tough. I mean, it's tough because pregnancy does, throughout the course of a pregnancy, is going to change the shape of your body. For some people, it's going to change, how they view themselves, their self-esteem, and we have to address that as physicians. We gotta recognize it. That's real. It's real. It's how somebody feels about themselves and so forth. Once they deliver the baby, a lot of moms, they'll feel self-conscious because, I have moms that you deliver them, and I have somebody. If you go to my Instagram, you see I have a bunch of pages where, like, models, professional TV people that they look good for a living, right?
That's right.
Those women, some of them deliver and they, a week later, like, you had a baby. But majority, normal, everyday, moms that go through this will not. There'll be a period of time when they transition from my pregnancy body to like what I was like before, or what I, a healthy body weight, or
what I'm working on. Yeah.
And then so they get kind of worked up that, should I wear a binder? And the binder, it definitely makes you look however, perhaps what you want to look like immediately.
Right.
Does it in the long term actually shape your body and help you heal different in order to contort your body into that shape?
Right.
That's a big area of debate, because there haven't been done any real studies in order to do, it's kind of impossible to do a randomized, placebo-controlled, typical scientific study of whether that works. So depending who you ask, if you ask probably half of my patients, they'll swear by it. And they'll use it every time because their mom and their grandma used it. The one thing I can tell you is that whether it works or it doesn't work is that it doesn't harm anything. So if it makes you feel good, it makes you, good about yourself. And now we'll say some people feel a lot of support because the abdominal muscles get stretched. So definitely the binder for some people makes them feel more secure. So that in itself would be a reason to do it. Whether it has a long-term benefit, then that's an area of debate, depending on who you ask. But scientifically, I can tell you that it absolutely does.
Good. Well, if you let us know if there's ever a scientific research study.
You'll be the first to know, I'll tell you.
Okay, shifting gears a little bit, I kind of want to wrap up our segment with you, talking about a topic that's hard to talk about, that I feel like sometimes moms are afraid to ask, or they just think I feel this way because I just am supposed to feel this way. But talk to us a little bit about postpartum anxiety and depression, and when to know that it's something that you need to seek out more help with.
So a lot of moms are there's a lot of different emotions that go through after you've had a baby. So especially oftentimes the first baby is even the toughest because it's a big adjustment. So if you actually look at at anxiety, depression scores of life events, right, and how they impact you psychologically, how they impact you, emotionally. There's scales that look at like what people rate. How did this affect my life? Death of a very close family member, a sibling, your mother, your father, is ranked here. When you look at childbirth, it's almost ranked around the same.
Wow.
So a lot of people, and that causes a lot of guilt in a lot of people, a feeling of, this is supposed to be the happiest moment in my life.
Time of my life, right?
Why do I feel this way? Well,
right.
why do you feel this way? Because up until that point, maybe it was just you and your husband or your boyfriend. That was it. That was your life, and maybe your immediate family member. Now all of a sudden, all this shift, everything is turned to a baby.
Yeah.
And it's tough. It's tough because it's a complete change of routine, a complete change of priorities. And even though you love your baby, you're happy that you have your baby, your world kind of turns around. And for some people, it will lead them down a path where they feel bad. They actually get emotionally sick. So the idea of baby blues, which a good percentage of people are going to go through, that's something that it's generally mild. You have some feelings of sadness. Sometimes it's frustrational. You have a baby crying. You're not sleeping. That's normal. It's normal, and that's where you depend on family support from friends, from your partner. But then sometimes it goes a little deeper, and then sometimes it'll last beyond 30 days. Or sometimes it doesn't have to meet the 30-day criteria like we did traditionally, but you're just having very negative thoughts. And so I always tell moms, being sad, being overwhelmed, being so forth, wanting to have a glass of wine, that's okay. Okay, everybody's going to go through that. At some point, I remember coming home one day and my wife is sitting on the porch of the house and drinking a glass of wine. And I said, okay, let me get in there and figure out what's going on in there.
What happened?
And it's the baby's fed, the baby's diapers changed, and the baby's still crying, and you can't figure it out. It's frustrating. But whenever a mom stops taking care of herself, so she's not feeding herself, more importantly, she's not taking care of the baby for any reason, those are questions you have to ask patients. Those are questions that you should be asking a new mom. And sometimes you can do it casually. Sometimes it's obvious that there's something going on. And that's when we start dealing with depression. And then depression, in some cases, there's pharmacological treatment. So we give medications to help them get out of there. Sometimes it's a matter of going to therapy. But depression is depression. Will it be postpartum, or will it be just depression? Like many people suffer from depression. So it's more of to what degree, how am I taking care of myself? Am I taking care of my baby? And that's when it should trigger that, okay, this is more than just baby blues.
Right. No, that's good and so important. So any moms that may be listening in, we just encourage you, Miami Mom Collective, our heart and our passion is to be a support for moms, to encourage them, equip them, and empower them. But certainly if you're ever dealing with thoughts or feelings like that, there's so many amazing medical professionals out there. Reach out. We always say motherhood is hard, but it doesn't have to be lonely. And sometimes being lonely can be the hardest thing, especially this crazy season we've all been living through, which is, a part of the reason why we wanted to have this event. Is just for moms to be reminded that you're not alone. Even if you're watching alone from your house, you are not alone. So Dr. Cardenas, getting better. We're so thankful that you joined us tonight. Thanks so much. So many great topics that we're able to cover. So I want to transition now to Anita Jiha. So we have a lot of moms who have just had a baby in the really last month. I know there's several listening in that have had a baby in the last month or so. So I know you have a lot of wisdom to share about breastfeeding, and you've got, my goodness, more than 20 years experience under your belt, and you're the coordinator at Mercy's Hospital's, their childbirth classes, their lactation program. And I know you offer tons of support for new moms and maybe second, third time moms who are still, breastfeeding is a journey every time. So we're so excited that you're here, and excited to learn from you. So we have a ton of questions and I want to jump right in. Let me pull some of them up here. And then moms, again, if you have them, drop those in the comments. But let's see. Okay, let's talk about, first of all, what are good foods that would help supply, and maybe foods to avoid in terms of milk production.
All right. Milk production is based on supply and demand. The more you nurse, the more you make. So food has nothing to do with it. We do, recommend you keep a good, healthy diet. Like everyone should do that. And food to avoid, nothing need to avoid. You don't need to avoid any food. Again, so the more you nurse, the more you make. It's very simple,
Yeah,
I mean,
just keep feeding that baby.
feed the baby, you make milk. That's it.
Okay. Hey, that's good. We can do that.
Yeah.
Okay. What about, one mom asked in particular, is it normal to have milk even after you've stopped breastfeeding for 5 years? So maybe she had a baby and then 5 years later she's having another one. Should she be
Yes.
concerned about any problems?
No, the only thing is the fluid, if you try to express to see, the color should be clear or yellowish or whitish.
Right.
No other color, no red or green. So yes, it's normal because I remember that happened to me too. My son was 5 and I was still having milk. I go, oh, wow.
You're like,
But yeah, as long as it's not green or red, you're fine. Yes.
okay.
Normal.
Great. It's just amazing what our bodies do, and we're made to do.
Exactly.
It's incredible. It's incredible. So one mom asked a question, which I think you maybe already touched on, but she said, are there any supplements that you recommend for increased milk supply? She said she's worked so hard to build her supply, but she's feel like it's dwindling. And she wants to start pumping again, but she doesn't get as much. So it's same concept. Would you say just start nursing him more? Or?
Right. It depends on the age of the baby. I think the baby is 8 months old.
Uh-huh.
So usually they're on solid.
Right.
So all she has to do is just keep nursing. And once they start solid, it's a weaning stage. So
Right.
basically the pumping only extract 1/3 of what's in the breast.
Okay.
So that's not an indication that she's running out. So the key is just keep nursing that baby.
Okay.
And don't worry so much about what she get out with the pump, because the pump, like I say, it doesn't take out as much as the baby does.
Yes. Okay. Speak a little bit to us about, I remember as a first time mom, my first, and someone had told me a little bit about, people don't prepare you for these things. So this is why we're passionate about preparing moms for this. But a friend just mentioned like, oh, cluster feeding. And I was like, oh, wait, what? And then when my first baby came, I was like, what in the world? Like, I feel like I've just been nursing for 10 hours. What's going on? Talk to us a little bit about that and any tips or tricks or your opinions on that.
Yeah, babies do have periods where they feed often. Those are called growth spurts. Usually any number of days divisible by 3. You have 3 days, 6 days, 9 days, 12 days, 15, so forth, or the 3 weeks and the 6 weeks, where it's their job is to make milk. So the more the nurse, the more you will produce.
Right.
So they're called growth spurts, means they eat often. And that's only a day or so, and then they go out of it and then get back to normal again.
That's good.
But if they start noticing the baby start clustering, that's normal. Just sit down, feed, and it will get
Netflix or whatever and get comfortable.
Exactly.
And you know what?
Normal eventually.
Anita, that's a great perspective too. Instead of like, oh, this baby's eating again, but seeing it as it's beneficial to your supply. Like this is helping me establish everything for the long haul. That's good. That's great. Okay. Let's see. We've got another mom who says, what are some reasons that her baby would have difficulty latching? She's due in December with number 3. She had issues with her first 2. And she only ended up having milk production for about a month after birth because of her latching issue. You have any tips for her?
Basically, once a baby is born, they don't eat right away. Okay. Right. Some of them do, some majority of them don't, because they're very sleepy. And there's a few reasons. One, sleepy. Okay. The key is to be patient, give them time to wake up and start getting hungry. And also positioning makes a big difference. Also the way they hold the baby, the way they position the baby to get the baby to latch. So basically my advice is to be patient. There's no need to interfere with, supplementing unless there's a medical reason, blood sugar or baby's losing way too much weight than necessary. So basically just keep offering the breast, keep waking the baby up every 2 hours and be patient. They will get hungry and eventually they will latch.
Okay.
So
stay with it. Ooh, that's endurance.
Exactly.
It's not easy.
Exactly. They get fun. I know it's hard. It's frustrating at times because you want the baby to eat. But if the baby does not want to latch, it's because they're not hungry.
Right.
They do get hungry. So it's just a matter of keep offering and a little persistent.
And we'll figure it out.
Exactly. They'll
That's
get
right.
hungry.
Okay. Speaking.
Uh-oh.
Think she's
Is it
I don't know.
frozen,
Here, I
right?
think
It's frozen.
she's-
Did we freeze? Yeah.
Yeah.
I think it's frozen.
Yeah.
I think it's frozen.
Any tips there?
Oh,
No, we
I'm sorry.
didn't hear your question.
Oh,
We
it cut
lost
out.
you for a minute.
Oh no,
we
okay.
lost you. Yeah.
I'm back. So one mom, I said, she mentioned that she had mastitis 8 times, and she said it was terrible. No one could figure out why it continued, other than possible overproduction. But could there be another reason or a reason why she was so susceptible?
Sometimes bacterial, can cause it. Again, one of the main reasons too is oversupply. So in mismanagement of the way they handle the oversupply. So sometimes they pump more than they should, or they do more bottle. They don't feed often. Again, one of the reasons baby eat often is to drain the breast to get the milk out, so it doesn't accumulate. You see, so the more they bottle they give, the more they use pacifier, the more they pump, those will cause mastitis. So lack of drainage. The breast is not getting drained properly by the baby. Again, baby is the key.
Okay.
To avoid that.
So babies are a little indicator
Machine.
of it's time to eat again. Baby says it's time. Okay, let's see. What are some reasons that you could see a low supply?
Well, one is breast surgery.
Mm-hmm.
That could be one, because we do have a lot of women with breast surgery that will affect the milk supply. Lack of feeding, again, the usage of breast pump, supplementing, all that will interfere with your production.
Okay, that's good.
So it's avoid those as much as possible. Like I said, unless there's a medical reason, the best thing to do is to breast nurse exclusively the first 4 weeks before you start introducing pumps.
Okay.
Also pacifiers, or using pacifier early on will again keep the baby away from the breast, so it won't nurse as often because they're tired from sucking.
That's good. Okay,
so they won't stimulate the breast.
Okay, so give them
pacifier is one thing you want to avoid. Yeah.
Okay. All right. One mom says she's currently exclusively breastfeeding her 3-week-old son, and she's noticed that he has a difficult time feeding from her left side, almost as if like the milk is releasing too quickly and he can't keep up. Is there something that she could do to prevent this, or another position to like comfortably feed him?
What she could do is it's called the L position, which means you put the baby in a football but upright.
Okay.
To help with the flow.
Yes.
Sometimes that helps. Correct. On the side. Yeah. Sideways. So that's one. Also, maybe you could nurse on one breast at a time. She could do what's called block feeding on one, and then to slow down.
Okay.
Yeah. The L position is one of the
What she needs to do is call Anita and go spend some time with her. I'm like, this week, next year we're gonna have an add-on option to be like, you get a personal meeting with Anita to bring your baby.
Sure.
Hopefully
that sounds good.
We can be back to real life, because I know you do some amazing groups for women. So hopefully we can get back to that here pretty soon.
Yeah.
Let's see. Okay, what about nursing strikes? Any tips on that when they start to reject the breast?
Nursing strike, again, there's a couple of reasons. There could be environmental, what's going on around the baby, stress. Also, what I recommend to do is do what's called a baby honeymoon. Means hold the baby as much as possible, carry the baby in a sling or a carrier, and offer the breast often. Okay. That's one of the solutions to help with the baby nursing strike. Again, it depends on what the strike is about. If it's getting a lot of bottles, they'll refuse the breast if they get a lot of bottles, because the flow of the bottle is so much easier than than the breast. So
less work for them.
It could be different reason. Yeah, I would need to get more information to really know what really happened.
Right.
But that's one way of managing nursing strike.
Yeah. Talk to me. Let's transition a little bit. We got a few minutes left. So many great questions coming in. So I'll encourage Anita to join us in the comments later. Maybe she can answer some more of these, but we're doing our best to get through all of them. But let's transition a little bit to pumping. Moms who are exclusively pumping, maybe they're working. That's just been their choice. Can you pump and then say, hey, let's try, we're 4 months in or whatever. Let's try this again. Is that possible? And then also any tips
You mean
have
to
for working moms?
To exclusively pump?
Yes.
I mean, yeah, I do have a lot of moms who go back to work, but they have to in order to maintain the supply, the baby still had to nurse.
Right.
So exclusive pump, only a few people are able to do this without putting the baby to the breast, where they can do it for a long time. But majority end up, again, drying out because, like I said earlier, the pump only removes 1/3 of what's in the breast.
Oh, so
It's
yeah,
only an extraction.
Okay.
Correct. So they have the mom that are going back to work, the recommendation is to have a 2-week supply already in the freezer before they go to work.
Right.
Because the milk supply fluctuates.
Ah.
Because you're not with the baby as much anymore, you're doing more pumping than nursing. So the best thing is to nurse before going to work, pump at work every 3 hours, nursing at night, and nursing on weekend to kind of able to maintain and to bring it back up.
Supply, yeah.
See? Okay. Yeah. I mean, there are some moms that are able to exclusively pump, but very rare. Not too many are able to do that because they end up, you know, supply decrease.
That's interesting. I didn't realize that about the pumps are only getting 1/3 of what's in the breast.
1/3.
Wow.
Yeah.
Wow.
Takes out less than the baby.
And if I can say something, something about that? So we have a lot of moms when they're separated from their babies, that the babies go to the NICU and they cannot really go to the breast right away, either because they're premature or because they're very sick. And most of these moms are able to produce enough food for their babies as long as they pump often, as often as if you would breastfeed, like 2 to 3 hours day and night.
Right.
That's one thing. The other thing is once we start doing skin to skin helps a lot. So holding your baby will help the milk come. That physical contact, like Anita was saying, you know, carry the baby in a sling and all that, that helps a lot. But for moms that are physically separated from their babies, like what we recommend is, you know, when you visit the hospital, you hold the baby, you do skin to skin, and then you pump because that contact is going to stimulate the milk, and you can see them. They tell you, oh my God, I held the baby yesterday, and then the milk started flowing. What I did personally when I went back to work and my baby was at home is like looking at pictures of the baby. You smell something of your baby, you go home and hear the baby cry, because these are all cues that are gonna make your body produce milk.
Right.
And these are moms that usually at some point we transition the baby to the breast. It comes with training. Like you can do it, but it's a lot of work.
Right.
And a mom that is working and now taking care of the kid at home is not as easy as a mom that is at home that can fully put themselves through it. It's doable, but it's a lot of pressure to put on a mom too that is now working and then coming home to do this extra labor, you know, so the human contact, right? Like the physical contact with the baby is really the key. But if there are moms out there that are worried about the babies being in the NICU and not being able to breastfeed, it's doable. But when we help them with that, we obviously and assist them into this transition. So it can be done. Bottom line, that's what I wanted to say.
That's great. No, that's great. Wow. Okay. This topic, we could do a 2-hour panel. We really could. But we're going to wrap up here just because I want to respect your time. And we also have another panel coming up here at 9:00. So ladies, hang tight. Still, I know there's a lot of questions in the comments that we didn't get to. I'll encourage our Mercy team here to visit those comments here in the next day or so and to get back with you guys as best they can. But just thank you so much. We're so grateful for all three of you being with us tonight and the expertise that you offer and your wisdom. And most of all, what you're doing to serve moms each and every day in this super challenging time. And the fact that you would take some of your own personal time from your homes after long days at the office and with your own families to be with us is hugely encouraging. So thank you very, very much.
Thank you.
Very well. Thank you.
Thank you.
Awesome. All right, ladies, this will stay in the feed. So you can go back and watch it or share it with a friend who maybe missed tonight. But stay tuned. Coming up in just under 10 minutes, we're going to have one more expert panel for the night, and then we're going to call it a night for Bloom 2020. So thank you again for joining us, and have a great night, everyone.
Thank you. Same to you.